Peripheral neuropathy is a progressive nerve disease associated with diseases from type 2 diabetes to excessive alcohol consumption, nutrient deficiencies, hereditary conditions, medication side effects, and toxic environmental poisons. Are you currently suffering from peripheral neuropathy? Do you have burning, numbness, pins and needles feelings in your legs, feet, or hands? Are you frustrated with the lack of effective treatment options for your neuropathy? If yes, you probably realize by now this is a progressive condition, worse today than 6 months ago. According to a study in the journal Diabetes Care, up to 26% of the type 2 diabetes population has peripheral neuropathy. Traditional treatment options really only deal with the symptoms of neuropathy. Medications to numb the nerves, topical treatments to numb the nerves, and even antidepressants. Therapies can include transcutaneous electrical nerve stimulation, or TENS for short, and physical therapy. The problem with these approaches is they don't actually address the cause of your dying nerves. The cause of the type of neuropathy we can help is poor circulation, as well as damage from external agents such as medicine side effects and environmental toxins. What if we could improve your circulation and help the nerves regenerate? Like giving a thirsty plant water. Our approach to neuropathy involves a number of interventions, and they all have one thing in common. They all improve circulation. Before I explain this approach to improving your neuropathy symptoms, let's go over some conditions that are tied to poor circulation and or cause damage to the small sensory nerves in your hands and feet. They include metabolic conditions such as diabetes, vascular disease, alcoholism, cancer due to the effects of chemotherapy. Yes, neuropathy is a common side effect of cancer treatment. Other drugs such as statins, antibiotics, antivirals, infectious diseases such as HIV, AIDS, and Lyme's disease, anemias, vitamin deficiencies such as B12, folate, and magnesium, Raynaud's phenomenon and scleroderma, and poisoning from toxins such as lead, mercury, and Agent Orange. So as you can see, there are many substances and conditions that can damage your peripheral sensory nerves and contribute to life-altering and debilitating neuropathy. My name is Dr. Robert Barton. I've been practicing since 1996 and I've seen thousands of patients suffering from peripheral neuropathy. The problem is, until recent years, we didn't have a great combined approach to attack this problem in all directions, including a fantastic home therapy that you can use as much as you want. I want to explain the physiology behind increasing circulation, but first, here are some clues that may indicate that you have poor circulation. Burning, shooting, throbbing pain, or electrical shocks or pins and needles in the hands or feet. Numbness in your hands and or feet. Balance problems, sores that don't heal, discoloration or swelling, lack of foot and leg hair or lack of toenails, night leg pain or restless leg syndrome, and cold feet. So here's the physiology behind increasing circulation. Have you ever heard of Viagra? Well, of course you have, but did you realize that Viagra works via the nitric oxide pathway? What is nitric oxide? Nitric oxide is a gaseous signaling molecule. It's biosynthesized endogenously, which means inside your body, from L-arginine and oxygen and nicotinamide adenine dinucleotide phosphate, or NADPH for short. Okay, let's get out of the scientific jargon weeds. What does it do? Nitric oxide relaxes smooth muscle, allowing for increased circulation. That's how it causes increased circulation when men take Viagra and when men and women take a medicine called nitroglycerin, which also dilates blood vessels to treat angina or chest pain. Nitric oxide has the following vascular effects. It dilates arteries and capillaries. It dilates veins and lymphatics. It's a mediator of angiogenesis and other growth factors or blood vessel creation. It reduces platelet aggregation. Why is nitric oxide so important? Capillaries and extremities are the size of a single red blood cell. High cholesterol and diabetes contribute to endothelial dysfunction as well as blood vessel narrowing and reduced elasticity, leading to hypertension. and high levels of blood glucose reduces the availability of nitric oxide. No wonder type 2 diabetes patients so often suffer from progressive peripheral neuropathies. Nitric oxide also reduces pain as it's a direct mediator of the analgesic effect of morphine. Nitric oxide indirectly reduces hypoxia, ischemia, which is low oxygen. It delivers nutrients to nerves. It reduces inflammation and swelling, which impinges on nerves by reducing tissue pressure. To date, there have been 4,500 subjects studied and 21 published papers regarding a therapy called anodyne therapy. The infrared treatment used with anodyne therapy is called MIR, or monochromatic infrared photoenergy. I would be happy to send you the PDFs of these papers along with the exercises to help your balance if you suffer with peripheral neuropathy. More on that later. If you dig in and read the studies, you would discover the proposed mechanism of action of MIR. To quote the study's symptomatic reversal of peripheral neuropathy in patients with diabetes, and this is out of the Journal of American Podiatric Medical Association, the physiologic basis of the improvement in neural function may be due in part to improved circulation related to the localized release of nitric oxide. Here's another excerpt from a study, Reversal of Peripheral Neuropathy, out of Endocrine Practice, 2004. The current data strongly suggests that ATS, or anodyne therapy, treatments delivered in the manner described significantly improve sensory impairment associated with peripheral neuropathy, at least temporarily. Now, I could go on, but you can request the studies if you'd like to read more. The bottom line is sensory improvement and nerve function can be achieved with MIR or anodyne therapy. But of course, we don't stop there. We also include 12 lymphatic circulation massage sessions to physically stimulate circulation within your hands and or feet. We also teach you balance exercises so you can keep your balance systems tuned instead of being at the mercy of progressive worsening. Our program also includes a proprietary supplement which contains a therapeutic dose of L-arginine. Remember, we mentioned earlier in the video, L-arginine helps with increasing nitric oxide production. So not only do we address circulation with the anodyne therapy with a licensed massage therapist by improving your circulation through exercise, but also with oral agents known to upregulate nitric oxide production. Either way you slice it, you are doing everything known to increase nitric oxide production and improve your circulation and reduce your progressive neuropathy symptoms. There is simply no better combined approach. Check out what others have said about anodyne therapy. Here is our process. Step 1 involves a consultation and exam. We will discuss your symptoms, measure your sensitivity with the Sims-Weinstein monofilament test, which is the same way they measure sensitivity in the studies. We will conduct a functional balance test, the same balance test we can teach you to perform at home. We will then discuss whether you are an appropriate candidate for this therapy. The cost of the exam is covered by some insurances depending on your insurance company, deductibles, etc. If you don't have insurance, the cost of this consultation and exam is $80. If you're a good candidate for treatment, we begin phase 1. This is the in-office phase of treatment. It includes 12 anodyne treatments for each lower leg or your hands, 12 lymphatic circulation massages, 2 months of Neuromed, the therapeutic L-arginine and other nutrients to upregulate nitric oxide production, balance and circulation improving exercise instruction, and a re-exam to measure your progress. Now, if you improve to a satisfactory level, phase 2 involves getting your very own anodyne infrared treatment system to use at home. You will own the system, and you can use the anodyne therapy daily or as needed to keep your neuropathy in check and obtain maximum results. It is so exciting to have the opportunity to offer you this comprehensive program. I look forward to meeting you in person to help determine if this is a good fit for your neuropathy symptoms. See you soon, hopefully. If you want more information regarding exercises performed at home and the self-assessment for balance, please provide your email address and we will send the information immediately. I will also send you my analysis of the studies published on anodyne therapy. Don't worry, we hate spam as much as you do, and we will absolutely not share your email with anyone. Call 281-991-3002 to make an appointment. We are looking forward to seeing you soon.